Good afternoon everyone, Dr. Glory here. Today we are going to discuss about PCOS. Earlier it was known as PCOD, but now we call it as polycystic ovarian syndrome. Poly means many, cis means sac or fluid-like structures which are seen in the ovaries. In Telugu we call PCOS as niti budukalu. So in a normal female, number of follicles are always assigned at her birth, and these follicle numbers will always get decreased as the age passes. So when from 400 millions of follicles, the follicles number will reach up to 400 when she comes to a reproductive age group. So out of these follicles, every month a group of follicles will be recruited, and under the influence of follicular stimulating hormone, the one follicle will get matured, and along with it the egg will also mature, and it is released during the ovulation time of period. When coming to PCOS, there is always an hormonal imbalance is seen. This hormonal imbalance will be either due to hypothalamo-pituitary ovarian axis disturbance or due to the ovary fault in the ovary. So when this happens, the follicular stimulating hormone, which is responsible for the maturation of follicle, is produced at a very low amount. So when this is produced at a very low amount, there will be a lot of immature follicles will be seen, and also along with that the egg will also not get matured. But along with these hormones, there are also other hormones like luteinizing hormones. This luteinizing hormone will be at its peak during the PCOS condition, and due to the LH hormones, also the androgens and the testosterone will also be in higher rate. Normally in a female, the androgens and testosterone are also, the male hormones are also seen in a female in a very low amount. But in case of PCOS, these male hormones will be higher in amount. So when coming to the symptoms of PCOS, due to this hormonal disturbances, as there is imbalance between the female hormones and the male hormones, the symptoms are seen like irregular periods and absent of periods, that is amenorrhea, and there is also, due to the excessive male hormones, there is male type of baldness is seen in the females, and there is excessive growth is seen, that is excessive hair growth on the areas like chin, jawline and arms or the chest or the back, that is known as hirsutism condition is seen. And there is also insulin resistance along with this hormonal imbalance. Due to the insulin resistance, there is pigmentation is seen on the neck and the underarm region of female. This pigmentation is nothing but called as acanthosis nigrans, which is due to the insulin resistance. And also there are nodular acne on face are seen in a female with PCOS condition, and there is also obesity is associated in the PCOS condition. But every patient who is obese is not always a PCOS patient. There are also some patients who will be lean in mass. So the main drawback of PCOS is infertility. It causes 70 to 80% of the cases of infertility will be due to PCOS condition. So how do we diagnose the PCOS condition? One can go for hormonal test examination, where hormonal tests like FH, FSH, LH ratio is determined, and as we all know, FSH will be at lower and LH will always be at higher in case of PCOS condition, and there will also testosterone and androgens will also be at rise when you examine these levels. And we can go for ultrasound scanning, which is the diagnostic feature of PCOS condition, where multiple follicles will be seen in the scan. Now coming to the part of treatment, whether it is allopathy or homeopathic part of treatment, always PCOS can be managed via diet and health management. So the diet plays always an important role in any case of PCOS condition. So healthy nutritious food diet, and then reducing or cutting down your carbs is important feature. And then one has to go for weight management, and also then exercises are important, and also stress management is very important. And then one can also should always take good amount of water intake should be there. Then next, coming to the allopathic part of the treatment, we will see that hormonal pills are always prescribed in case of allopathy path of treatment, like birth control pills, combined oral pills, progesterone pills are prescribed. And next, we also see that for hirsutism like condition, dexamethasone in the 0.5 mg is prescribed. And if a patient is suffering with infertility due to PCOS, then clomiphene citrate, which is an selective estrogen receptor, is prescribed in the 50 or 100 mg dosage. And then letrozole, which is an aromatase inhibitor, is prescribed in the 2.5 or the up to 20 mg of dosage can be prescribed. And metformin plays a very important role when it comes to managing PCOS, because as we all know, metformin, it reduces the insulin resistance, and also it helps in the clearing of this male hormones, that is androgens and testosterone. Now coming to the homeopathic part of the treatment. In the homeopathic part of treatment, we prescribe based upon the constitution, that is your mentals and physicals are always taken up by a doctor, and then according to it a constitutional drug is prescribed. We have many number of wonderful homeopathic drugs like Thuja, Calcarea carb, Calicarb, Apis mellifica, Sepia, Pulsatilla. These are the commonest drugs which are prescribed for PCOS condition. And also some tinctures like Senecio, Pulsatilla, Ashoka, Gossypium, these are prescribed. And then next is I just want to say that even if you are suffering with PCOS, do not worry and do not panic for the disease, because it can be treated, and it can because there are many ways to treat it. Either you can choose homeopathy or you can go for allopathy as per your convenience, and you can go for the treatment. So there is always a scope, even if you are a PCOS condition patient. And you can also consult me for PCOS related health issues. You can contact me, or you can DM me at my Instagram handle at Glories Homeopathy 2016. Thank you. Have a wonderful day.